Good afternoon, everybody. Christine Varconi here in the NBC4i Streaming Center, joined by Dr. Joseph Gastaldo from Ohio Health, infectious disease expert for the system there. We're going to talk about a couple things today. First up, we're going to talk about COVID booster shots for elementary school children because yesterday Pfizer asked the FDA to approve its booster shots for about 1/3 of the dosage, just like for its regular first two shots for school-age children. Can I get your thoughts on that? And if you think that is going to help our kids as they continue to stay in schools this year?
Absolutely. The short answer to that is yes. The best thing we have to protect people from this virus is to get a booster shot. We have this vaccine, both for Pfizer, available for 5 to 11-year-olds. But the vaccine we know is only against the ancestral strain, and the virus has changed, and it will likely continue to change. Hence, the tentative plan is to have some type of regular period where we get a new booster shot. So what we have now is Pfizer officially asking for FDA emergency use authorization of a bivalent booster. It is the same exact dose as the original vaccine that age group gets. The only difference is that half of the dose is against the ancestral strain and half of the dose again is against the Omicron subvariant. So that is going to offer another layer of protection from children. And when people get this vaccine, they will get a rise in their antibodies. And having these higher antibodies, especially during back to school, winter and fall months, is going to offer another layer of protection to keep kids back in school.
Do you anticipate the FDA approving this rather quickly?
I do. The data still has to go through the FDA's Vaccine Advisory Committee. And then after the FDA hopefully grants this authorization, it'll go through the Vaccine Advisory Committee within the CDC for the recommendations.
Okay. So would you recommend to your patients to Central Ohio, once this is likely approved, for them to go out and get their child boosted?
With no hesitation whatsoever. In fact, I think the best way to protect ourselves and our community is for everybody who is eligible to get a vaccine or a booster to receive them.
Okay. And even if you aren't in the high risk category for COVID, you might have a few mild symptoms. Why is it important, regardless of that, to make sure that you aren't, contributing to this community spread? Who is it protecting, essentially?
Yeah, so the more people who get vaccinated, we're actually protecting each other better. After you get vaccinated, you do have high antibody levels for a period of time. And when you have high antibody levels after being vaccinated, you are less likely to get infection. You're going to clear the virus quicker. There's more to an immune response than antibody levels. Antibody levels do come down over time, but the other type of immunity that you get are these long-lasting memory cells that will kick in if your antibody levels get down low enough where you get a post-vaccination infection. These vaccines were designed to prevent people from being hospitalized or dying. And in that metric, those vaccines are performing very well.
So, who needs a booster shot right now in the general population?
Yeah, so right now, anybody who is eligible to receive a booster should get a booster shot. So for the vaccine booster that we have available now, the CDC defined eligibility as anybody who is at least 2 months out from their previous shot. I will say clinically, I'm telling my patients, and the CDC does define this, they say, if you have had COVID, you can wait about 3 months to get your next booster.
Mhm.
Please keep in mind that with this new booster, it's kind of a booster reset. The previous booster is no longer available. So if anybody goes to get their first booster now, this is the one they would get.
Okay, so for example, I feel like my experience was a one that was held by a lot of healthy adults. I got my booster last fall, but I did end up getting Omicron in December, January. I should get this new booster.
Absolutely. If you had Omicron, like you described over 10 months ago, you are eligible to receive this new booster today. In addition to that, we don't know what's going to happen this year as far as influenza or flu goes. The canary in the coal mine is the Southern Hemisphere, Australia, New Zealand. They had a pretty rough flu season, and we are advising people, obviously, to get their flu shot too. You can get them at the same time, or if people prefer, you could separate them too.
Okay, so let's talk about masking because there are some reports out today, the major media outlets I was just reading from The Hill, that universal masking in hospitals has no longer been recommended by the CDC, but there's a big caveat. And can you kind of explain that?
Yeah, first of all, I want to say when someone comes to Ohio Health and in a hospital, that we do prioritize safety for our associates, safety for our patients, safety for visitors. We have been wearing masks in hospital settings now for a long time, over 2 years, and the CDC does give the recommendations for mask wearing in the hospital. So last Friday, the CDC revised their guidelines and basically stated that when there are times of high level transmission, that's when masks need to be worn in the hospital. Right now, in the state of Ohio, out of all 88 counties, we still have high transmission of the virus. That's what's happening out in the community. Although there is high transmission in the community, we do not have the hospital being overrun by COVID patients. So, when there is high transmission, the recommendation is to wear masks in the hospital and only to de-escalate that if you get below high transmission. That's very confusing for people because the CDC also produces another map called community level. That's based more so on what's happening in the hospital with COVID-19 patients. Franklin County, for example, right now is low community level when it comes to COVID, but high transmission. And it's a transmission level that really determines mask wearing in the hospital.